Okay, guys, I have discussion for you. We are doing a narrative on health theater. Um, Title is Health Together. The story of a rural patient in the system that must change. On a on a cold February on a cold February morning, just after dawn, I sat at the kitchen table for a of a patient I'll call Mary. Her oxygen tubing curled across the floor like a second set of roots, tethering her to the concentrator humming in the corner. Outside, the nearest neighbor was half a mile away. The nearest hospital with an open inpatient unit was nearly an hour. Mary had been coughing for weeks, but she didn't call. Not because she didn't care about her health, she cared deeply, but because she couldn't afford to miss a day's wages at the diner, because her daughter's car was unreliable, because the pulmonologist she needed to see only came to the local clinic once a month, and the next appointment was already full. I'm not ignoring it, she told me. I just don't know how to get there. This is a rural healthcare America, not a lack of will, but a lack of workable options. The distance between illness and care. Rural communities live with a geography of vulnerability. A heart attack is not just a medical emergency, it's a race against miles, weather, and the hope that the volunteer EMS crew is available. A, a behavioral health crisis is not just a clinical need, it's a question of whether the nearest therapist has openings before next session's harvest. These are not isolated stories, they are patterns. Rural Americans face higher rates of heart disease, diabetes, COPD, cancer, mortality, and disability. Nearly 200 rural hospitals have closed or cut inpatient services. In the last 2 decades, workforce shortages stretch from primary care to EMS to behavioral health. This is not a failure of individuals. It is a failure of infrastructure, policy, and immigration. Healthier together, a chance to build what rural communities have long needed. The federal health, the federal Healthier Together framework offers something rare, a moment when rural communities are not being asked to make do, but to reimagine. But reimagination requires honesty. Rural healthcare cannot be rebuilt by copying urban models. It must be built around the realities of rural life, the long distances, the aging workforce, the economic fragility, the deep community ties, the pride of the resilience. A true healthier together approach means expanding rural workforce pipelines so clinicians come from and stay in the communities they serve, empowering nurse practitioners, pharmacists, paramedics, and community health workers to practice at the top of their training, building telehealth systems that actually work with broadband. Devices and digital literacy, not just video platforms. Integrating transportation, food access, and home based supports into care delivery. Stabilizing rural hospitals through value based payments. The rewards outcomes, not volume. It is not modernization for modernization's sake. It is modernization for survival. The human stakes. When rural hospitals close, it is not just a loss of beds, it is the loss of a maternity unit, a trauma bay, a place where neighbors gather for blood pressure checks and flu shots. It is the loss of the largest employer in town. It is the loss of a safety net woven through generations. When rural clinics can't recruit clinicians, it is not just a staffing issue, it's the erosion of trust, the quiet grief of patients who must tell their stories again and again to strangers who may not stay. When transportation fails, it is not an inconvenience. It's the difference between catching cancer early and catching it too late. What rural communities are asking for. In every rural town I visit, the message is the same. See us, hear us, build with us. Rural communities want care that honors their time and geography. Not every appointment requires a long drive. Not every test requires a hospital. Not every crisis requires the ER. A workforce that feels like family. Clinicians who stay long enough to know the roads, the families, the histories. A system that treats social needs as clinical needs, because a patient without transportation does not have access. A patient without broadband does not have telehealth. A patient without food security does not have a fair chance at health. A healthier rural America strengthens the entire nation. Rural communities feed the country, power the grid, and anchor the cultural and economic fabric of the United States. Their health is not a niche concern, it is a national priority. Many eventually make it to the pulmonologist, but it took 12 or it took three rescheduled appointments, two borrowed rides, and a day's lost wages. Not one should have to work. No one should have to work that hard just to receive basic care. Healthier together is not Healthier together is our chance to build a system where stories like hers are no longer the norm. A system where geography does not determine destiny. A system where rural communities are not asked to adapt to healthcare, but where healthcare finally adapts to them. If we get this right, we don't just improve rural health, we honor the dignity, resilience, and warmth of the people who keep this country running. Okay, guys, that is your C for tonight. I will be on tomorrow for shows. Until then, Gator Wellness. Have a good night, folks.